Yeah, good morning everyone, and thanks very much for coming along, and thanks to Martin for asking me to speak this morning. As Martin said, my name is Tineke Broer and I work at the University of Edinburgh. And between 2013 and 2015, I was working with Martin on a project on neuroscience and how it is used in policy and family life. So that's the project in the context I will be talking about today, and just giving you some of the findings of this project. So just to give a brief overview of what I will talk about, after a brief background and study overview, my presentation comes in two main parts. The first is about how neuroscience is used in British and then in Scottish policy contexts. And that's a big question, so it will be like a very general overview of some of the findings. And then to give an idea of how neuroscience then can be used in family life by parents with young children. I'm talking about some of the interviews we did with parents with young children and what they thought of neuroscientific advice for their parenting practices. And I will end with some concluding remarks. So, neuroscience and how it is used for policy, especially early years policy, has gained a lot of attention from social scientists. And a lot of these social scientists have been quite critical of the way neuroscience is used, or even the fact that it is used for policies. So some scholars talk about the misuse of neuroscience for things policymakers want to do anyway. Whereas other scholars talk about the undesirable consequences that the use of neuroscience might have. For example, the focus on individual problems rather than looking at how problems arise in a social context, or the consequence of making parents very anxious of using their time very, very well in order to develop their child's brain in the best way they can. So that would be a more critical perspective that some social scientists have taken to look at neuroscience in policy. In contrast to that perspective, there are more descriptive approaches, and I would say our study was very much a descriptive approach, looking at how neuroscientific concepts and terms are used in policy as well as wider contexts, in what settings and with what consequences as well, including potential positive consequences. So just to tell you a little bit more about what we did, it was a 2-year study. The PI was Martin Pickersgill, co-I's were Professor Sarah Cunningham-Burley and Professor Ian Deary. And as I said, we looked at the way neuroscience is used in policies, particularly but not only early years policies, as well as how it is then translated to family life. And the methods, the project consisted of a range of methods, but for this presentation I will only draw on 3 of the methods we used. So the first is a policy document analysis we did of 86 British policy documents, mostly relating to the early years, but also some relating to adolescence and older age, which I won't be talking about today. And then we did 11 interviews with policy and social service actors, looking at how they saw neuroscience being used for policy and social services, and what they thought of it. And then finally, we did 22 interviews with parents with young children who were recruited from one of 2 parenting programs in which they heard about neuroscience in relation to parenting. And we talked with them about what they thought of these programs and of the advice they received and how it might help them or not. So that's the background from which I will be talking about today. So the first part will be looking at how neuroscience was used in British policy documents and then in a mostly Scottish policy context through the accounts of policymakers in interviews. And you may all be familiar with the iconic image of how neuroscience is used in a policy context. So you see here on the slide the front cover of the Graham Allen's Early Intervention report, which depicts, which comes from Bruce Perry's study on Romanian orphans and the impact of extreme neglect on children's brains. So the left, is that right? Left, yes. The left brain is the normal, what they call the normal 3-year-old brain, compared with an extremely neglected child's brain from a Romanian orphan context. And this image, as well as the ideas associated with it, have had a lot of impact on policy making. And for example, the claim is that funding for the early years has been increased because of such ideas. So the Allen report, the Graham Allen report, is not the only one talking about the brains of children and how important it is to develop their brains in a good way in order to help the children themselves, but also help society and the taxpayers' money in the end. So this is a quote from the Foresight Mental Capital and Wellbeing report, talking about the importance of intervening early in children's lives through their parents' behaviors, so that children might become less vulnerable in later life. And so I'll just read out the quote. The mother's health during pregnancy and the quality of the nurturing that the infant and young child receives program the brain biology of the developing child and making the child more or less vulnerable to stress, mental health disorders, and physical diseases later in life. And the ideas expressed in this quote were common across the policy documents for early years we looked at, although not all policy documents adopted neuroscience uncritically or even adopted neuroscience at all. So that's the caveat to this, that not all the policy documents did this, and some actually were really critical of the way neuroscience is used. Now then, looking at how policymakers talked about this, policymakers and social service actors, I should say, were quite diverse in how they looked at neuroscience and how it was used, or how it is being used for policy. And a lot of their accounts were pragmatic in that neuroscience helps them to address things that they thought were problematic. So in this quote with respondent 10, who has been quite influential in how in neuroscience's use in Scottish policy context, he talked about how neuroscience can be almost a strategic move to address what he thought as inadequate policy responses to social inequalities. So he said, in trying to bring some science to this, I'm trying to move the argument. It's all very well for me saying it's disgraceful. There's hundreds of people out there who are saying it's disgraceful, but I'm saying actually the disgraceful way you treat the poor people means their families are fractured, and it means generation after generation is growing up to have problems. And he furthermore said that the harder the science is, the better it is to convince politicians and society in general. So here we've called this, borrowing from Boswell's work, we've called it this epistemic authority, where neuroscience is seen to have more authority to address a problem than, for example, social science or political arguments more in general. Resonant of the previous quote, but very much in opposition with it, was the interview we did with respondent 5, who works for a family charity. And she was very critical of the way neuroscience is currently used for policy. And she said this was mostly a justification for what people want to do anyway. So she said, again resonating that neuroscience is seen as harder than other sciences. She said, people have a trust in science that they don't have in social science, and rather than having the emphasis on, say, relationships or how we behave towards each other, there's a tendency to put the trust in something that's scientific and that we can prove that works. And I think from my understanding and from what I've read, it's very much an emerging field, and we treat it on a really simplistic basis. So such cautious engagement with neuroscience and more critical engagements, critical perspectives on how neuroscience is used for policy were not uncommon in the interviews we did. And one of the main criticisms from social scientists in the literature as well on the use of neuroscience for policy is the impact it might have on families. So that's why I want to just give a brief demonstration of how it might resonate or not with parents who are at the receiving end of this advice, if you'd like. So I will focus here on parents who did a parenting program in which they heard about the Romanian orphans, among other things. And this was a piece of advice they brought up themselves in the interviews we did, in 10 out of the 22 interviews. So clearly it made an impact on them and they remembered it still. But they didn't always talk about it necessarily as being positive. And a lot of the parents said that they thought it was interesting to hear about the Romanian orphans and the importance of loving your child, but it didn't make them do anything differently. They might think about their child in a different way, but it didn't impact their parenting practices as such. However, some parents did talk about it changing the way they raise their children. So this is a quote from a father we spoke with. And he had 2 sons, and he heard about the neuroscience and the Romanian orphans in specific, and the importance of loving your child more in general. In between, he was bringing up his older son and bringing up his younger son. And here he was giving the example of what he would do on the bus with his younger son. So he said, even when I'm on the bus, I would never have 1 minute with silence. I will always be communicating with youngest son or oldest son now. Whereas when oldest son was a child, there maybe would have been times when maybe 10, 15, 20 minutes would go past without any communication, you know? But now that I know how important it is and everything like that, it's quite crucial. And he was very grateful for having received this advice and saw it as making a difference to his children. So he spoke about all of this very appreciatively. In contrast to that, there were some parents who were much more critical of the use of neuroscience in parenting programs, and in particular, the neuroscience as relating to the Romanian orphans and the importance of loving your child. So this is an interview with a mother we did, and she, while being appreciative of the parenting program, didn't think neuroscience and the Romanian orphans were particularly relevant for her. So she said they, in the program, talked about orphans in Romania, or when the brain doesn't develop because babies are neglected, and that wasn't applicable to any of us there, you know. We were all caring moms, and I thought, but there was nothing that made me think, oh wow, that's new, and it was kind of like just reinforcing what we maybe already knew. And there were some other parents who talked about this as well, that actually neuroscience, and particularly the advice on the Romanian orphans, was not applicable or relevant for their Scottish parenting context. And that then shows the diversity of how parents receive such advice, and also the critical way in which they can sometimes reject certain advice, but take what is valuable to them as well. So just to end with some brief conclusions, I think across the policy interviews and family interviews we did, we saw how different actors in different spheres critically negotiate expertise, and in this case the neuroscientific expertise, to fit their settings, and sometimes reject it as well. So in policy contexts, sometimes neuroscience was seen as having an enhanced objectivity relative to, for example, psychology, but at the same time it was sometimes resisted as well. And in a family context, we saw how parents reject certain advice, but then take what they think is valuable for their child and for their parenting practices. And this then, I would suggest, nuances critiques of parenting programs and of the necessarily anxiety-provoking nature of the advice. Thank you very much.